Hello, and welcome to Ethical Decision Making. Ethical decision making is a part of every single health professional's role and can be part of every single day as a speech-language pathologist. Whether this is knowing whether you're allowed to provide private services outside of your role, what to do when asked to testify at a custody hearing for one of your child patients, or whether it's simply when a parent doesn't have the capacity to bring their child in for therapy when you can tell they desperately need it. Ugh, what do you do? Today, we'll be talking about a method of ethical decision making called the Ethics of Care approach. We'll be outlining and going through the steps of the approach, applying it to a case example, and finally, highlighting the pros and cons of the approach. Speech Pathology Australia, or SPA, follows a strict code of ethics to ensure that speech pathologists provide quality, efficient, and effective services of the highest standards of ethical practice. The SPA model of clinical practice encompasses ethical values, ethical principles, and standards of ethical practice. These are overarched by Aboriginal and Torres Strait Islander responsiveness, cultural and linguistic responsiveness, and person-centeredness. But how do we apply this in a practical sense? Enter the Ethics of Care approach. The Ethics of Care approach is based on using effective care relationships to solve healthcare dilemmas. It refers to the willingness of health professionals to advocate for individuals, families, and communities, and is underpinned by empathy, compassion, loyalty, and sensitivity. The overlap between the Ethics of Care approach and the SPA Code of Ethics is that effective interpersonal relationships are the core of speech pathology. Therefore, the Ethics of Care approach is pivotal in upholding the SPA Code of Ethics when interacting with clients, professionals, colleagues, and the community. The process of analysis that we can use follows 7 steps. 1. What are the needs of the individual and family affected by this ethical issue or problem? Are my clients empowered to make decisions about their healthcare? What are the roles and responsibilities of the healthcare team in providing quality care? Are there any barriers to effective care? What resources are required to provide competent healthcare? How are clients responding to care? How can I improve care offered to clients? Let's apply these steps to a case scenario. 2.5-year-old Sophie is seen by you, the community speech pathologist, on the recommendation of the early childhood nurse due to concerns about Sophie's speech and language. Julie, Sophie's mum, has been visited by the nurse following the recent birth of Jack. During the session, you observe that mum appears tired with flat affect and that she does not interact with Sophie or the new baby. You discover that Sophie has a moderate speech and language delay. Due to the long waiting list, the only option for this family is a parent training group. When you discuss this with Julie, she bursts into tears. Julie opens up to you and states that she's been experiencing symptoms of postpartum depression. Julie also shares that her partner has recently left, which has left her caring for her 2 children on her own. Let's apply our 7 steps of the Ethics of Care approach to this case to help us understand how to move forward. Number 1. What are the needs of the individual and the family affected by this dilemma? This taps into the SPA values of person-centeredness, respect and dignity, quality and safety, and the SPA principle of beneficence. Sophie's needs are clear. She has a moderate speech and language delay and requires speech pathology support in order to assist her in her developmental journey. However, extraneous factors such as her mother's own well-being may be a barrier in Sophie receiving intervention. Julie appears to be struggling emotionally. She's opened up to us that she's experiencing postpartum depression since Jack's birth, as well as newly becoming a single parent. This makes us aware that she potentially doesn't have the emotional capacity to address another challenge in her life, and may feel shame around being recommended a parent training group. She appears to be overwhelmed and may require additional support with her children, as well as her own emotional well-being. Let's ask ourselves, how would this client, Sophie and Julie, define quality care? Quality care in Julie's eyes may mean care that's accessible and realistic to attend as a mother of 2 young children who's also facing potential mental health struggles. Let's also ask ourselves what the key relationships are in Sophie's life. Sophie's key relationship is with her mother, who the majority of the responsibility for seeking support falls to. Therefore, knowing Julie's capacity in providing the support as the primary caregiver is pivotal to how we'll address Sophie's care. Determining Julie's support networks is an important step to take in facilitating her attendance and access to the training group. Let's also ask ourselves how the care provided will help Sophie maintain important relationships. The care provided to Sophie will increase her speech and language outcomes, which will also empower Sophie to connect and make meaningful relationships with her family, friends, and set a strong foundation before she attends kindy that will enhance her interactions and overall well-being. Number 2. Are my clients empowered to make decisions about their healthcare? This taps into the SPA principle of autonomy and the SPA value of respect and dignity. Julie appears to be overwhelmed at the moment and does not appear empowered to make healthcare decisions for Sophie, and appears currently exhausted and mentally and emotionally drained. Number 3. What are the roles and responsibilities of the healthcare team in providing care? This taps into the SPA values of quality and safety, professionalism and integrity and responsiveness, as well as the SPA principles of truth, beneficence and fairness. Let's ask ourselves, what are the speech pathologist's responsibilities for care? We have a good understanding that early intervention will achieve the greatest outcomes for Sophie, and that parent training groups can be an effective means of introducing communication elicitation strategies with the patient. We have the skills to offer the support and a method to do so, however Julie appears too overwhelmed to be able to capitalise on the support being offered. We need to also be aware of not placing too much strain on Julie, as this may create more harm than good for Sophie's home environment. Let's also ask ourselves, how can the team collaborate to facilitate care outcomes? We can facilitate other healthcare practitioners to try to support Julie, as this will in turn support Sophie, working in a family-centred approach. This may mean referrals to a social worker, a counsellor, or a psychologist to support Julie with her emotional needs, or to help Julie source the support that she may require. We might also consider using an allied health assistant in the parent training groups who can assist in supporting parents with their children whilst attending the class. For example, we might ask for an additional AHA to attend the parent training group to provide hands-on support to Julie with baby Jack so that Julie is able to attend to the information. In addition, we may offer for parents to bring their children to the parent training program and offer supervised play in an available therapy room while parents attend the workshop. An additional option could be for an AHA to complete home visits to practice the goals designed by the therapist with Sophie to enhance Sophie's outcomes without overwhelming Julie too much. Number 4. Are there any barriers to effective care? This taps into the SPA values of quality and safety, responsiveness, professionalism, integrity, respect and dignity, as well as the SPA principles of beneficence, justice and fairness. Let's ask ourselves, how effective is communication between the client, carers and the health professional? The communication between Julie and us appears to have opened, with her stating that she is postpartum depression. However, she appears disengaged from the session, which may affect outcomes for Sophie's care. This highlights the importance of linking Julie in with services to support her own well-being, which in turn will help Sophie's well-being. Let's also ask ourselves, are there any factors, including policies or structure of the health service, which may disempower this client? The current barriers to providing care for Sophie are Julie's capacity to attend the weekly parent training classes due to limited family support and emotional overwhelm. In addition, the unavailability of one-on-one speech pathology sessions is a barrier, which means the parent training classes are the only option. These training classes may be a barrier as they are not an accessible option for a single parent with limited support for caring for their children whilst attending. If Julie is unable to attend classes, this may affect the care that Sophie receives. Julie also has limited support at home to carry out the strategies. In addition, Julie may require an explanation on the parent training program, as her emotional reaction may be in response to a misinterpretation of the recommendation of the program as not succeeding as a parent. Number 5. What resources are required to provide competent healthcare? This taps into the SPA values of quality, safety, professionalism and integrity. Let's ask ourselves, do we require more knowledge or training to manage this client, and are the available resources appropriate? When thinking about Sophie's case, we might require further training on postpartum depression and how this affects outcomes for children with speech and language delays. We may also require training or collaboration with a psychologist to incorporate a method for the strategies to be simple and achievable for a mother who's already overwhelmed. Another resource may include some incidental counsellor training. Another resource that we may require is access to an allied health assistant in order for home visits to be carried out and to carry out therapy activities to enhance Sophie's outcomes. Number 6. How are clients responding to care? This taps into the SPA values of respect and dignity and responsiveness, and the SPA principles of autonomy, beneficence, truth and fairness. Let's ask ourselves, how is our client responding to care and what feedback mechanisms are in place? Julie has responded immediately with a negative response to the care being provided. This doesn't mean that she is not willing to engage, however shows that there is a barrier that's being faced in our provision of care. We need to provide feedback mechanisms so that Julie can express what the barriers are to Sophie's care, so that they can be addressed by staff and the situation can be resolved. We also need to counsel Julie to help her understand the evidence behind early intervention and parent training programs, while also being open to tailoring this service to Julie so that her barriers can be addressed and we can positively support her attendance without increasing stresses. And finally, number 7, how can I improve the care offered to clients? This taps into the SPA values of quality, safety, professionalism, integrity and responsiveness, as well as the SPA principles of beneficence, non-maleficence, truth, justice and fairness. Let's ask ourselves, how can we effectively advocate for an individual client and family? We can effectively advocate for Sophie receiving the speech pathology support she needs by first providing an accessible service that her mother, Julie, can attend. This might mean allowing Julie to bring both children to the session and have a room set up for supervised play while she attends the class. This might also mean an AHA going out to the home to practice strategies and client goals with Sophie so that Julie feels better supported to address Sophie's speech and language needs. This might also mean linking Julie in with a health professional who can help her to address her current support needs, whether these might mean finding affordable creche services or accessing a psychologist or social worker to achieve a longer-term solution to support this family. Let's now ask ourselves, what steps can we take to facilitate knowledge, skills and resources for the clients in our community? The steps we can take to facilitate knowledge and resources for clients similar to Sophie in the community is moving towards setting up accessible services that allow for families to attend who don't have much support. Let's also ask ourselves, how can we advocate for changes in policies and service delivery that will enhance client care? We need to motivate and lobby for accessible services for single parents, typically those who are experiencing challenges with their emotional well-being. This could include AHAs completing goals within the home, supervised playrooms in the clinic while parents attend the training program, and multidisciplinary input from psychologists and social workers to help parents who are struggling. Now let's talk about the strengths and the limitations of the ethics of care approach. The strengths of this approach are that it's responsive to the needs and the emotions of clients and their families, it considers the client as a whole, it acknowledges the complexity of human relationships, it facilitates an awareness of the impact of power relationships in ethical decision making, and it's a proactive approach that empowers speech pathologists to advocate for clients. We saw this in Sophie's case. We had to be very responsive to Sophie's needs, but also to Julie's needs as her main carer. We considered Sophie within her own environment and the networks that she has, as well as acknowledge the complexity of relationships, particularly between her mother and her, and how this could affect her care. This approach facilitated our awareness of the impacts of these complex relationships, as well as helped us to see the importance in advocating for Sophie as well as Julie so that Sophie could receive the care she needed. The limitations of this approach are that it may require an extended skill set, it requires highly competent interpersonal skills, speech pathologists need to monitor their personal and professional boundaries, and they may need support to address injustices of the healthcare systems. Also, change requires time and an eagerness to address broader professional issues. We saw some of these limitations in Sophie's case. First of all, to be able to engage in this process, we'd need an extended skill set such as incidental counselling training, as well as knowing more about postpartum depression and different ways we can make therapy more manageable for Julie. We also need strong interpersonal skills and to make sure that our personal and professional boundaries are in place, particularly when working with someone like Julie, who appears to be struggling emotionally, which may have an impact on our own well-being. Today, we've learned all about the ethics of care approach. I hope this has been meaningful to you and will become a method that you use in your day-to-day practice as a speech pathologist.